Okay, thank you, Professor Yuan, for the fascinating presentation. Now we will open the floor to questions. If you have any question, please type into the Zoom chat or feel free to raise your hand and we will call on you and answer your question directly. Is there any questions? Okay. There is a question from an audience. He want to ask Professor Yuan, you found that mindfulness reduces anxiety by alerting metacognition anxiety coupling. Do you know whether this change is stable over the long term or is it mainly observed after the short-term intervention? Could you please clarify this?
Yeah, that's a good question. Actually, to ensure this, right? Actually, for our experiment design, actually, you can take a look at in this slide. In this slide, yeah, okay. So for our experiment design, right? For normal control people, for healthy people, right? After 4 weeks, mindfulness intervention, so it showed the symptom improvement, right? Show the improvement on the impaired cognitive functions after 4 weeks intervention. Then we stop here. Then 2 months later, we continue to do the scanning. We see that the change still significant. I think no show. No, I mean, they still keep a very stable standard for the intervention efficacy. I think the intervention results for normal control people. We are not quite sure about the 2 months later because the time later for our project, right? Students need to get graduate in 4 years. But my understanding that it's over two. I mean, the efficacy can be kept for several months. It should be okay. And for MAD patient, I think yeah. After also we also do the same thing after 8 weeks intervention. Then we found that after intervention, right? Then 3 months later, then we didn't do the MRI scanning because the limitation of the equipment. We don't the university does not, we don't have a lot of time slot of scanning for the patient. But also patient very hard to further to come here, right? For not let the patient, it's very hard let them to come here to the further scanning. But we do the questionnaire for the MD patient. Also, even 3 months later, right? I mean, they are. I mean, the symptoms still the improvement, right? Didn't show that decreased. I think. I mean, the efficacy is still there. I think. Yeah. 7 months is okay. I think if over 7 months, I'm not quite sure. Yeah, that's it.
Okay, thank you very much for the insightful response. Let's move on to the next question from a youth editorial board member. He want to ask regarding the finding that baseline neural features can predict individual responses to mindfulness. Do you see potential for applying these brain imaging markers in clinical pre-screening to personalize mindfulness interventions? Could you please provide your perspective?
Yes, I think it's a very good question. I think, yeah, yeah, we have talked to the monthlies, I think they have a certificate. They kind of, not a doctor, it's that kind of, we call it experts, who have the certificate in mindfulness meditation. And also talk to the the MD in the hospital. Yeah, it's well, we talked to them, particularly for the depression patient, right? For MDD, right now most of the people actually, most of the patients, they only take drugs. Take drugs for some drugs. Some patients they take drugs for a couple of years. Yeah, sometimes the drugs work. Sometimes maybe in the beginning the drugs work very well, but later it's true. It's I mean the efficacy actually show the significant decrease. Or the significant decrease, or not so significant regarding the efficacy compared to the treatment effect in the beginning, right? So drug yeah drugs taking drugs it is still the number one option in the hospital. But right now they also do some kind of TDCS, TMS, physical based intervention, and also the symptom improvement only lasts some people last 1 week, or some people last 2 weeks. Some last I mean the efficacy can last around 1 month or something. Then several weeks or several months later, I think I mean, the patient have to take drugs again. I think, yeah, they combine the physical intervention with the drugs to treat the MD patient, but efficacy is still not. We can control the kind of symptom for a couple of years if you take drugs every day, right? And also do the TMS intervention every month or every 2 months. I think it's still okay, but we cannot treat the patients. Treat the patient totally let the patient get recovered, become a normal people. I think Chinese medicine and also the mindfulness meditation is really show the efficacy. Sometimes I know some MD patients really got recovered after like Chinese Zhenjiu and Jianmo, Zhenjiu and Jianmo, and also combined with the mindfulness intervention and exercise as well. So basically, some patients, especially MD patients, really got recovered. That is amazing. Yeah.
Okay. Thank you for your answer, Professor Yuan. Is there any questions?
So I just yeah, and a little bit. So yeah, that's the if we can before the really I mean drug treatment, right? TMS, if we can use mindfulness, right, to let the patient become calm down, and I think yeah, it's still a good treat and a protocol for the intervention of MDD patients. Uh, yeah, we can start the mindfulness earlier. I mean, but it's but for MD patient, they already become patient, right? So the first one we still take drugs or take drugs to control their mental standards. And then after that, we can use either the Chinese medicine or either the mindfulness meditation or traditional Chinese Zhenjiu combine together to let the patient really get recovered totally. I mean, yeah, yeah, that's it, totally recovered. Not only become normal people, healthy people, but not a patient again. Yeah, it's possible. Mm.
Okay. Is there any questions? It seems there are no more questions at the moment. Thank you again, Professor Yuan, for your
Sure.
insightful presentation and thoughtful answers. We also appreciate everyone's participation and great questions today. We hope this session has been informative and inspiring. Thank you all for your attendance, and we look forward to seeing you at our future events. Please feel free to reach out if you have any questions or would like to learn more about our journal. We look forward to your continued attention for BME Horizon. Have a great day.
Okay, thank you. Have a nice
Okay,
day.
thank
Bye
you.
bye.